huge need for addiction services in New Orleans. There's a huge problem with with quality inpatient recovery programs, and I think Bridge House is the best one in New Orleans. The track record speaks for itself. One of the things we ask family medicine students to do in the third year is to put together a project of some kind that has a benefit to the preceptor or his or her practice or to the community at large. And Ben Springate was a third-year student at that time, and he, for his family medicine project, did a needs assessment at Bridge House, for medical care to see what sort of help they might need and that sort of stuff, and he put together the clinic as a product of that project. So the clinic grew out of a family medicine clerkship requirement, and then students just kind of kept doing it. It's been a student-run, student-organized, student-directed clinic and organization since the beginning.
The value of having a clinic at Bridge House, which was student-led as opposed to a traditional clinic in which patients do not see students, is the opportunity for student leadership to develop, for students really to gain an appreciation for the roles that they later in life, later in their careers, will be able to play, supporting people who may have disadvantages or maybe underserved, and to provide an opportunity for leadership development, for entrepreneurship, innovation, critical thinking as pertains to organizational development. So there are a lot of areas of leading a clinic like this that become uniquely valuable to a student later in their career that they otherwise may not have exposure to, either before they went to medical school or in their other medical school activities. We felt like it would be a terrific learning environment, and the notion of having a student clinic there seemed to be a win for both organizations.
My name is Tamar Khan. I'm a third-year Tulane medical student. What I think Bridge House does that is phenomenal for med students is it provides them a space to learn on how to pretend to be a physician. And I feel like pretending's the hardest part. So getting the confidence to see patients, getting a physical and history, those are all very basic, very important things to do as a med student. And I think Bridge House helps you learn to do that. I'm just glad Bridge House exists, and I think more schools need to take on this model where you're helping the community as well as teaching students, and everyone wins.
My name's Lauren Zerbe. I'm a third-year medical student at Tulane. So I started Bridge House as a first year, and I became a Bridge House leader my second year. And then my third year I was, now I'm a Bridge House third-year coordinator. So I've been involved with Bridge House since the very beginning. And when it started, it was like very much in a room that we would put up like clothespins. It felt like very like third world. Like you come in, you put up, everyone gets their sheets and puts up, makes these like makeshift rooms. And I kind of like that feeling. Now it's a little nicer, but that's kind of probably what drew me to it.
My name is Larissa Thomas. I'm a fourth-year medical student at Tulane University, and I am pursuing a career in family medicine. So Bridge House, as a fourth year and the third years, we act as preceptors, so as mentors and teachers to the first and second years, who are the driving force for this clinic. The first and second years, they'll come in and see patients and then present to one of us. We'll work through the physical exam and then work on an assessment and plan for whatever that brings the patient in for the day. So whether that's an intake history and physical, or whether that's a follow-up, or whether that's an acute problem, we'll work through that, and then we sort of watch by and help refine the presentation of the first and second years to the attending physician, and then help carry out what that is. So in a sense, we serve as sort of like a resident type role for the first and second years. The resources are limited, and that is what defines an underserved population to me, is that the resources that are broadly available to a community that is not underserved are not available to those that are underserved by definition. And the challenge for working in those environments is to be able to develop, identify, and work around those challenges. And that can be really fascinating and also really rewarding.
My name is Shubha Sarkar. I'm a fourth-year Tulane medical student. I've been working at Bridge House for the past 4 years, ever since I was a first year. What we do as Tulane students are every week we do intake physicals for all the people who come in, kind of give them a general health screen, and we get to learn a little bit about them, learn a little bit about their psychosocial component to their addiction, and also treat any medical problems. So it's kind of a win-win. We learn about all aspects of the patient. They know that they can, if they stick this program out, that they can, become part of the community again. And they always have this support group within Bridge House. It's a great teaching and learning opportunity because you're learning physical exam skills. You're learning to interact with people in the community, which first and second year medical students don't get to do a whole lot of. And it's good in terms of learning practical aspects of medicine from the family medicine doctors who work with us here.
It's a great clinic with students to learn and start to get their first physical exams and continuity of care when they see the patient week to week and follow their blood pressures and different issues and get their primary care and other issues addressed here. So it's a good service.
My name is Colin Devlin. I'm originally from Marblehead, Massachusetts. I'm a second-year medical student at Tulane. It's guys that are kind of down on their luck and looking to change their life around. So they're just very responsive, and they want to do anything to get better. And so you create a pretty cool bond with the patient.
Thank you for volunteering at Bridge House. I think you'll find through your career, if you continue to do this sort of work, and I hope that you do, you'll find you get so much more out of it than you actually give. That's the whole paradox of volunteer work, at least for me, is that you get more than you give.